Thank you, Ben, for this wonderful introduction. So, wonderful talk, Keith. Very interesting, very inspiring, especially the prediction error work, right? Okay, so I will focus on the prefrontal cortex in my talk, and maybe I would like to start with showing this slide. Basically, as you can see, in the past decade, the neuropeptide oxytocin has made it into the world of clinical neuroscience. There are tons of clinical studies right now registered in trials.gov, which examine the clinical use of oxytocin for a plethora, basically, of clinical disorders, ranging from autism to several types of anxiety disorders. So it's a big field right now, I guess. This was actually one of the first studies, and Keith was involved in that as well, showing that oxytocin, after intranasal administration, makes it into the CSF. You can see here a nice peak, 75 minutes after intranasal administration. And what you can also see here is that there is also a peak here in the blood after 15 minutes, and then there is a kind of plateau for about 45 minutes before the oxytocin level basically drops. And we believe that especially the CSF data actually suggest that only maybe a small fraction enters the CSF and must accumulate in order to deliver a positive signal, whereas the majority of oxytocin, which has been intranasally administered, actually interacts with local receptors and then gets degraded in brain tissue, where it initiates a network response. That's our current hypothesis. Nope, sorry. So in monkeys, intranasally administered or inhaled oxytocin reaches the CSF around about 15 to 60 minutes. And it was also shown by a recent study by my colleague Mary Lee, who works at the NIMH, that nasal oxytocin does not induce any peripheral or central release of oxytocin. So it seems that the signal that we see in the brain relies on what we administer intranasally. And fMRI studies in monkeys and humans basically converge on the idea that oxytocin reduces activity primarily in the amygdala to fearful and aggressive phases. So this is a paper that was published a couple of years ago by our colleague Leslie Ungerleider. And the problem is that what is often lacking is a dose-response curve. So many people administer oxytocin at different doses, and actually there was no data suggesting which dose produces the strongest effect on the amygdala. So we had the idea of doing a dose-response study, and this is what I show you here. So we had 200 scans, basically. People came twice to our lab and were administered oxytocin or placebo, scanned on a facial recognition paradigm, very easy task. And we scanned them while doing this task. And what you can see here is that oxytocin inhibits the amygdala. That's actually the basic effect that we see in many of our studies, an inhibitory effect of oxytocin on amygdala function in response to facial or other stimuli. Oxytocin also enhanced insular responses, and this makes it quite different actually from benzodiazepines, for instance, which also decrease insular responses, but in this case we see an increase in insular responses after oxytocin administration. And inhibition of the amygdala was actually strongest with the 24 international units dose that is seen here, yeah? And it occurs in a time window between 45 and 75 minutes after nasal administration. Higher doses of oxytocin, in this case the 48 international units dose, actually produced the opposite effect in this study. It increased amygdala responses to facial emotion, to fearful faces in this case. And of course, we were discussing this on quite a few conferences now, and There are different hypotheses where this effect might come from, and one idea is an inverted U type of oxytocin function in the brain, and the other idea is that oxytocin might actually interact with another subtype of neuropeptide receptor, in this case the vasopressin V1A receptor. That's just a hypothesis. So this is a very amygdalocentric view of the anxiolytic effects of oxytocin, and this is of course very simplistic. So what are the network effects of oxytocin? And as you all know, oxytocin has a major role in social behavior, and these are very early connectome models, actually dating back to the 1990s. They were based on lesion and neuroendocrine data, and these models basically assume that social behaviors are not represented by activity of the amygdala, but emerge from distinct patterns of activity within a social behavior network. I think it's quite a remarkable study. But these early connectome models of social behavior do not yet emphasize the crucial role of the prefrontal cortex, especially of the medial prefrontal cortex, particularly in top-down control of amygdala function. And we all know that fear expression is regulated tightly through MPFC top-down inhibition, and insufficient top-down control is thought to underlie amygdala overactivity in many disorders and pathological anxiety. And developmental work has actually shown that there are very sensitive developmental periods of plasticity where those connections between the medial prefrontal cortex and the amygdala actually form. And those sensitive periods can be missed. And if they are missed, then there is no such plasticity, and there is a high probability that amygdala function is not controlled by prefrontal cortex in a very tight way. So one of the best studied roles of the medial prefrontal cortex is actually its contribution to fear extinction learning. And fear extinction learning is the very basic mechanism by which cognitive behavioral therapy, CBT, neutralizes pathological anxiety. And you see here an explosion of studies over the past years. We also studied the effect of oxytocin on fear extinction, and what we found basically in this big fMRI study was that oxytocin induced a global decrease in amygdala reactivity during fear extinction learning, which is consistent basically with our previous study. But it also enhanced dorsomedial prefrontal cortex responses, which are instrumental to extinction learning. And it also modulated connectivity, and increased connectivity between the DMPFC and the precuneus, region up here, and between the precuneus and the amygdala. And the precuneus, as you all know, is a region which is implicated in the conscious representation of our world, of our social world. So in addition to inhibitory effects on the amygdala per se, oxytocin facilitates medial prefrontal cortex functional connectivity, which most likely indicates increased salience of social stimuli and also better top-down control. The question now is, are these connectivity effects of oxytocin restricted to males, or do they extend to females? Because in this fear extinction study, we only investigated female volunteers. So we did another study, and in this study, we coupled visual stimuli to olfactory stimuli. So we were interested basically in oxytocin effects on chemosensory stress signals. And we acquired male sweat actually during the Trier social stress test, and this served as an olfactory stressor in this particular study. And on the neural level, oxytocin reduced stress-evoked responses in the amygdala in both males and females. There were also gender-specific effects, but the amygdala effect was actually present for both genders. And also in males and females, oxytocin reinstated the functional connectivity between the anterior cingulate and the fusiform face area that was actually disrupted by the stress orders presented in this study. So there is a nice connectivity modulation by oxytocin. So it seems that oxytocin-induced changes in functional connectivity of the medial prefrontal cortex occur in both sexes exposed to stressful stimuli. And in clinical psychiatry, of course, the paradigmatic disorder that makes patients suffer from anxiety due to stress is post-traumatic stress disorder. And the question is, what is the potential of oxytocin in PTSD? And there was a beautiful study published by our colleague, Dr. Miranda Olf in Amsterdam, and she showed that intranasal oxytocin can reduce PTSD symptoms in a subsample of trauma-exposed individuals exhibiting a very high load of acute PTSD symptoms. Oxytocin had no effect in subjects with a low CAP score in this study. Very interesting results. So administration of oxytocin early post-trauma might be a very promising intervention basically for preventing PTSD. But we don't know anything yet about the exact neural mechanism of action underlying this oxytocin effect. We were interested in that, and so in this study, which is not yet published, we focused on intrusive re-experiencing, because post-trauma intrusions are predictive of subsequent PTSD. So we investigated healthy subjects who were exposed to a microtrauma, basically an aversive movie, the movie Irreversible, which in addition to causing intrusions also increased electrodermal activity, breathing rate, and pupil size. So this is quite a nice demonstration that this movie actually is highly aversive. And it causes, as you can see here, it causes intrusions in healthy people for about 3 days. So those guys were administered with oxytocin. And interestingly, the oxytocin reduced intrusions, but only in those subjects who talked to other people about their feelings after watching that particular movie. And this is called trauma disclosure. And I think this effect is very interesting because it's highly important, especially for the psychotherapy of PTSD. And in those trauma-disclosing subjects, oxytocin administered over 3 days increased medial frontal gyrus responses to fearful faces, as well as functional connectivity between the medial frontal gyrus and the amygdala. Another anxiety-reducing behavior is social support. So what are the effects of oxytocin on social support? We were very interested in that, so we designed another, and this is the last experiment which I will show you. We designed another experiment where we studied to which degree holding the subject's left hand by the romantic partner, a stranger or a rubber hand, relieved the pain induced by electric shocks onto the left forearm. That was the basic design of that study. And of course, we were interested in how oxytocin modulates this pain-relieving effect. And receiving social support by the romantic partner resulted in greater activity, again in the medial frontal gyrus. And this was an effect that was further enhanced by oxytocin in this study. And during this partner support, oxytocin also enhanced the functional connectivity of the medial frontal gyrus with 2 regions, namely the anterior insula and the amygdala. So when looking at the effect of oxytocin across all these 4 studies, then one gets the impression that oxytocin inhibits stress responses in the amygdala. But on the other hand, it strengthens medial prefrontal cortex subdivisional functional connectivity with diverse regions, particularly precuneus, amygdala, the fusiform face area, and the anterior insula. A couple of years ago, Tom Insel, who's one of the pioneers together with Keys of oxytocin research, published this very interesting commentary in Biological Psychiatry. It's rather a critical commentary regarding oxytocin research, and I would like to briefly respond actually to this commentary by saying that there is a growing evidence now for a penetration of nasally delivered oxytocin into the brain, at least in macaques. And we know that oxytocin has some direct anxiolytic effects, most likely by dampening the amygdala response to fear and stressful stimuli. An intermediate dose of 24 international units and a latency of around about 45 minutes may be most adequate for measuring decreases in amygdala responses. And this is what Tom Insel actually wanted to establish. He used the term target engagement. And I think oxytocin has proven that it particularly targets certain brain areas, for instance, the amygdala, but also, as Keith mentioned, the insula and other areas. So I think target engagement has been shown. And in addition, oxytocin promotes a medial prefrontal cortex top-down control, which I think is a very nice and promising finding for developing innovative forms of anxiolytic interventions, particularly trying to augment CBT with oxytocin. This is one of the next things that we would like to do in our lab. I would like to thank all the people working with me. It's not everybody works on oxytocin, so we also investigate other topics such as brain stimulation and schizophrenia research, but many of them are involved in our oxytocin research. So I would like to thank you for your attention, and I would like to make you aware of our new book, which will come out, I think, this month on oxytocin, and many people giving presentations today have contributed to that book. Thank you so much.